almost all studies of lifestyle, including diet, exercise, caffeine intake, and alcohol, they all completely rely on the patient's recall and truthful reporting of one's habits over a period of years. Now, these studies, there have been many studies, may indicate that two things may be associated with one another, but not necessarily that one causes the other. Now, what are these two things? It may be that the adults who are in good health, they engage in more social activities, hence they have to take in or confine to all these amounts and enjoy moderate amounts of alcohol in that course of time. But that the alcohol has nothing to do with them making them healthier. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about higher health risks among young adults that has been reported from alcohol consumption than their older counterparts. Young people face higher health risks from alcohol consumption than their older counterparts. Now, this is in accordance to a new study that has been published in the Lancet journal. Now, this is the first study to report the alcohol risk by geographical region, age, gender, and even year. Now, this study suggests that the global alcohol consumption recommendations should be based on the age and the location, with the strictest guidelines targeted towards males between the ages of 15 to 39 years who are at a greater risk of harmful alcohol consumption worldwide. It also suggests that the adults who are aged 40 and older, having no underlying health conditions, may see some benefits from small alcohol consumptions between keeping it 1 or 2 standard drinks per day, including a reduced risk of diseases like cardiovascular conditions, stroke, and even diabetes. In every region, the largest segment of the population drinking unsafe amounts of alcohol were males. That was reported between the age group of 15 and 39 years. And for this particular age group, drinking alcohol did not seem to provide any health benefits and also presents with many health risks on the contrary. So from the global burden of disease data, the researchers were able to estimate the average daily intake of alcohol that usually minimizes the risk to a particular population. The study also estimates how much alcohol a person can actually drink before taking on excess risk to their health compared to someone who does not drink any amount of alcohol. So in the study it was noted that the recommended amount of alcohol for people who are aged between that 15 to 39 bracket before risking their health loss was 0.13 standard drinks per day, which actually amounts to a little more than 1/10 of a standard drink. Now, in general, for individuals who are aged between 40 and 64 years, safe alcohol consumption levels ranged from about half a standard drink per day to almost 2 standard drinks, yet they proved to be healthy. While for the individuals who are over the age of 65 years, the risks of health loss from alcohol consumption were reached after consuming a little more than 3 standard drinks per day. So keeping all these estimates under view, these suggest that small amounts of alcohol consumption in populations over 40 years older without having any underlying conditions may be associated with improved health outcomes, particularly those who are facing a high burden of cardiovascular diseases, but it has to be used in caution in the younger age group. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.